Welcome back to DocTalk. I appreciate you guys tuning in. This is our final episode. We're coming out, finishing up the year 2020, and you're watching this, I know, early 2021. But we want to say thank you so much for supporting the show and listening and getting to know some of the primary care doctors we have here in Pahrump. I want to say that one thing I've learned doing this is how much and how great we have the primary care and the things we have coming up in this area. Most people, when they came to me, they said, "Hey, I'm new to Pahrump. I don't know who to see, which doctors to go for." And I thought, well, what's a great way to get people to know more about their insurances is through their primary care doctor and getting the care they need. And it's important to know that you can go back and you can meet with these different doctors and see them before you actually make an appointment with them to see if it's somebody I actually want to even deal with. It's very kind of difficult to say. I hear from other people what they like, and it's hard to know what you're going to like, especially when it comes to a doctor. You don't know how smart they are, you don't know what they know, and you want to make sure that they match your ideas. We got to know like such doctors, Marianne Hazlett. She's been a great primary care doctor. She does a lot more holistic medicine and looking at different aspects of your physical life. And then we had on the show a couple times like Spring Mountain Medical, where they're dealing more with physical medicine and helping people in chiropractic care as well as primary care. And then we also met with Pahrump Cardiology and primary care practice, where they're really trying to change a lot of the healthcare in Pahrump with regards to cardiac stuff, and then also providing really interesting primary care and accessing a lot of facets with regards to like allergy and different kind of medicines there. We also met with like a new group in Vegas, like Partners in Primary Care, who they're coming out and trying to reform a lot of the senior population and change healthcare there. They're building out brand new, beautiful places all over Vegas and hopefully soon in Pahrump as well. And then we got to meet with Intermountain Healthcare, how they're changing things with care and how they're integrating with their new Utah clinics and bring out new insurance companies. So just a reminder, check out our YouTube channel and look at DocTalk and find all the different interviews you've done in the past. Share them with your friends and your family. Let them know, hey, these are the primary care doctors in town. If you're new to coming to area, let them know that, hey, there's some great opportunities for you to meet them virtually without actually having to bug them or make appointments and make a wild guess before you start committing your time to those primary care doctors. Wrapping up the year of 2020 and the whole COVID year, hopefully 2021 is a lot better for us, especially medically. And just a reminder that there are some times to make changes too. We got a call watching the show. A great viewer was watching one of the doctors, I believe Dr. Woodward, and said, "Hey, I really want to see her. And my Medicare plan right now doesn't allow me to see her. I'd like to switch." I was like, "Well, great. You missed the open enrollment period for a regular open enrollment for Medicare. But we do have another time frame between January 1st and March 31st. If you're on a Medicare Advantage plan and you want to make a one-time change, you're allowed I call it the buyer's remorse period. It's actually called the open enrollment period. You're allowed to make a one-time change from a Medicare Advantage plan to another Medicare Advantage plan, just one time in that time frame between January 1st and March 31st. So if you found yourself experimenting, finding that new plan during open enrollment, or maybe you just wanted to make a change but totally forgot about it, you can still do it one time. Give my office a call, 775-764-2252, or go online to battlebornfinancialadvisor.com and make an appointment with us, and we can sit down and talk to you about your different options, find you the right plan still, make sure you're taken care of. We also have a lot of people still returning 65, and they're aging into Medicare. Still a great opportunity for you to get insurance. We have 3 months before, the month of, and 3 months after your 65th birthday to get on a plan. Give us a call again, and if you're turning 65 pretty soon or getting Medicare new, if you've been disabled for a while, we can take care of you and take care of your plan options. Those of you that are not 65 or looking at getting regular health insurance still, we have until January 15th. Nevada Health Inc. extended out the deadlines till January 15th to enroll in insurance. Your coverage will start February 1st, but we still have time to do that. There are still wonderful tax credits available to make your insurance more affordable. And we have 2 new insurance companies that came to town this year, and they've been quite popular. Friday Health Plans is our one and only EPO, which uses a PPO network exclusively. And then we also have a new HMO called Select Health that's in town. Select Health has actually been doing Medicare stuff for a couple of years, and now this year they have an individual and small group plan, and they're owned by Intermountain Healthcare as well. So we have some great options this year, some great things. We've talked to some great primary care doctors in this town. And I want to wrap up 2020 and everybody know what their options are here. Um, Stay tuned. Hopefully next year we'll start doing we'll do some other episodes talking more about financial stuff and talk about that. And if you have questions about that, we also have certified financial planner in our office, which is actually me. We've been working in the industry for quite a long time. We do the healthcare stuff because in retirement, I have found that healthcare is the most underrated and underserved program in Medicare and in when you're retiring. And dealing with your finances, healthcare costs can really change your life. How many people I know, even my personal life, when I first turned 20 years, I was 21 years old, and I started driving motorcycles, and I ended up getting a little motorcycle accident and about a $30,000 medical bill from a helicopter ride. Now ended up being perfectly fine, luckily, but I learned the hard way of not having health insurance of what medical debt can do to you, and it really set my life in a really bad direction. And when I was young, financially, because I was in the hole just because of a bunch of medical bills that I shouldn't have had to incur if I'd realized, hey, I can buy health insurance. Didn't have anybody in my life to tell me, Brent, this is how you get health insurance. I just assumed it's something your employer gives you. And I didn't realize that you actually had to make a point to actually go out and buy your own. Partially maybe how I got into the industry in general. It's just learning these kind of little nuances of how to do it, how to access it. And I think a lot of people in the same way. It's like you're so used to so long getting insurance from an employer or somebody doing it for you. In my case, it was my parents doing it always for me. But then going to a point where it's like you got to do it on your own. And you learn quickly of how to do it. And there's people like myself, other brokers and other financial advisors that understand these things, and we're free to use to you. So give us a call and utilize our services and let us know how we can help you out. For the New Year's resolutions, maybe it's, hey, I want to get healthier, I want to get more fit, I want to use less of my insurance. That's great. And I really want to encourage that because you can get along better not spending so much money for healthcare than you're doing better financially in other ways. And I want your life to be happy and healthy. And hopefully we can help you budget your finances. So maybe you can make it so you can afford the health insurance premiums. Maybe you can make it so you can afford things you couldn't think you could afford before. I can't tell you how many people have come to me just trying to get out of debt and thought, I have all the student loans or all these costs that I'm just never going to get there. I just financially never making it. And it just boggles my mind as I deal with different people. I hear people in all different walks of life, people making very little in poverty, people making hundreds of thousands of dollars a year. And their experiences are so different. I have some people making 60, 70, 80,000 a year, and they're struggling harder than people making 20,000 a year. And it's all based on how do they live their lives financially? How do they live their lives? Do they see their doctors? Are they taking care of their own inner bodies? What are the factors that are happening? And we're kind of your counselors, and we help you look at those aspects of your life and find out where can we make improvements? How can we help make your life better? That's our whole goal at Battleborn Financial, is to just make things easier for you and hopefully guide you along your path in life and give you great advice. I can't tell how many times that people will if you follow some of the stuff we help you do, it makes your life even better. If you tell us information such as which doctors you want to see, what medications you're on for the insurance, we'll find the right plan for you. If it's financially, hey, Brent, I really want help with investing, or I have some money in my IRAs, how do I deal with that? Estate planning stuff, if you have questions about how to deal with your wills or trusts, how to update those, we can help you walk through that as well. Another unknown fact about Battleborn Financial Advisor, where we're located, we have 2 attorneys in our office that actually help us with some of the legal things that go on with life outside of the healthcare, such as like if you get in an accident, how to deal with your medical bills afterwards and getting compensation for that. Robin Holsteth actually manages that in our office and does a lot of the accident injury things. We also have Arlette Newvine with Newvine Law in our office too, where she helps people with regards to like contract laws and helping people get out of that, and even deals with like divorce and custody cases. She is phenomenal. We also have Robin, go back to Robin Holsteth at Holsteth Law. She works a lot with doing estates and trusts and getting those set up. So at Battleborn Financial, we're kind of a one-stop shop, helping with your financial goals, your medical goals, taking care of your insurance needs and your financial needs. And then we also have great attorneys in the office to help you with your legal needs as well. So give us a call, 775-764-2252, battlebornfinancialadvisor.com. We have a few minutes left in this segment. When we go to the next segment, we're going to do a little section. We're going to rebroadcast our very first episode with Dr. Hazlett and just see the first segment of that and watch that in the next segment. Just want to iterate where we came from in this whole journey in dealing with things of getting people to know who their doctors are and have a conversation one-on-one here in the show. Hopefully you had a great year so far with regards to watching the show. Unfortunately, 2020 has been just a roller coaster and just this craziness going on. We talked a lot about, if you look back at our episode list, you'll find we talked things about like COVID vaccines. We've talked about keeping yourself safe and socially distant. A lot of people have been afraid to see their doctor because you're thinking, I'm going to get sick if I even see the doctor. And some doctors' offices have decided just to go 100% virtual. But we have quite a few doctors here in Pahrump that have just like, I really want to see our patients. We want to make sure that if you're sick, you're getting taken care of, because COVID's not the only thing affecting us right now. We still have things such as anxiety, depression. We have allergies still affecting us. We still have cold, flus. We have diabetes still in our lives that we have to manage. And it's important you see your primary care doctor to make sure those things don't get really bad. We have time. Don't forget, January 1st to March 31st, if you're on Medicare, give us a call still. We can help you make changes if you need to. It's not like the end of the world. You didn't make all your decisions during open enrollment, or maybe you got sold that really crummy plan over the phone that somebody, Joe Namath or somebody on the TV said, hey, get this, get that. Give us a call and let us know what we can do to help you. We are here to help. We actually work full-time outside of open enrollment. Our office is open all year long, Monday through Friday, 9 to 5. We have some great health insurance agents. Aubriana, we had her on the show. We have Jinde. We have Jody Leavitt. They're all great people on my team. And then I work as the certified financial planner the rest of the year and help you guys with your finances. So please use us. And thank you for coming to Pahrump. And thank you so much for supporting our show. If you have any questions or feedback for us, we'd really appreciate it. You can email us. You can email me at brent@bbfausa.com. That's brent@bbfausa.com. That stands for Battleborn Financial Advisor. Look for our billboard on town. Hopefully you see it and mailers out there. And you have a wonderful, happy new year.
Welcome to DocTalk with your host, Brent Leavitt. And DocTalk with Brent is sponsored by Battleborn Financial.
Hello, welcome to DocTalk with Brent. My name is Brent Leavitt. This is our first episode here. I am the owner of Battleborn Financial here in Pahrump, and I want to create this series to help talk about primary care doctors and accessing care here in this town. A lot of people that come here and they always ask me questions about, when they were dealing with their health insurance needs in my office, they're always asking about who do I see for a primary care doctor, who's the best in town. And I want to create this segment and really interview and get to know the doctors. My office, we're not only a certified financial planner, but I have a couple health insurance agents that work with me that help people in finding the right needs for them, whether it be through the Nevada Health Link Exchange or even through Medicare. And in fact, I have one of their affiliate doctors here, Dr. Marianne Hazlett, that we're talking to today. And those that are on Medicare Parts A and B can actually join Humana. The nice thing about Humana, their HMO, it's a zero premium plan, and it's a zero copay to see Dr. Hazlett even. Right now, she just joined their PPO as well. Humana also offers a PPO. And one little common thing during this COVID crisis, Humana is actually waiving all their co-pays and stuff like that, even on their PPOs during the crisis. So it's kind of unique in what they're doing. But Dr. Hazlett, tell us a little about you and your practice here in town, and love to hear more about you.
All right, well, we have remained open for the COVID-19. We've been open the entire time. We do also offer phone visits, so patients that want to call in and get taken care of and get the prescriptions refilled and anything that they need, and they can still be in the safety of their home, but at the same time, if they want to come in, talk, if we need to examine them, we are welcoming them. Anybody who's sick, of course, we want them to stay home so there's no spread of the virus, but at the same time, we love to see people and we want them to come in. So our doors are open and we're seeing people every day.
That's awesome. And new patients to see you, I mean, you're one of the fastest in town. Like for people that say, oh, I hate to have to call my doctor, it's like 4 to 6 weeks, but you're less than a week, right?
Yeah, for a new patient, I can definitely see a new patient within a week. We also have walk-in daily. We also have patients that we can see quickly if you're sick, if you need something, we do have cancellations, and we just fill them with the patients that need to be seen that day. So we can get in people pretty quick. I also have a nurse practitioner, Paula Wabsis, who just joined, and she can also take care of a lot of these instant need kind of appointments, and she's open almost every day to have patients come in and see her as well.
And a lot of people might even know Paula. They've seen her probably before at some other practices too, right? And you're now at your practice
Yeah.
where you are?
She's she's new to me, but she's been in town a short time. She just became a nurse practitioner, and she's doing great, and everyone loves her. She's very, very sweet.
And Dr. Hazlett, her office is actually right there off of Homestead and the 160 in that little area right there. So she's pretty easy to get to. Her practice is growing. She's able to take new patients regularly. What makes you different than, what's your specialty, and what makes you better or different per se than any other doctor in the area you think that might be?
Oh, well, I'm a board certified internal medicine doctor. I also do skincare. The difference is we are a private practice, so I'm not an employee of like a large corporation. So we actually have time to sit down, get to know our patients, spend time with them, and really be able to help. I also very interested in natural medicine, alternative medicine. So anyone who doesn't just want to take, regular prescriptions, we can talk about diet changes, about supplements, and different things they can do to improve their health, so that they don't feel like they have to come in and take all of this medication. So I'm very much into alternative medicine, and that's
awesome.
another option that they have.
And a lot of our Humana members, they really love the fact that it's a zero copay to see you. And a lot of, even though a lot of their generic medications, a lot of them are zero copays and stuff on the plans, a lot of times they feel like they're just taking way too many. And even on like a lot of those, some medications are really expensive. They have those tier 3 and 4 medications, which are some of those insulins or things like that. And you help them with other alternatives too and stuff like that, right?
Absolutely. And the other really good thing about the Humana plan itself is if you have heart disease or diabetes, they have a special cardiology and diabetic plan where a lot of these medications that can cost hundreds of dollars per month are covered at a very good cost for diabetics, especially when you're talking about insulin or some of these blood thinners for cardiology. It's very important to get those medications at a price that you can afford.
That's cool. And I was going to say one thing, if you're ever interested in, as we talked about these things, if you guys ever want to make an appointment with me or my office staff about getting plans, you can call my office. We're here local, the 419-6025. And I'd love to have you guys make an appointment with Dr. Hazlett's office, even for like a first-time visit. As you sign up for a new plan, getting to know Dr. Hazlett. I know for a fact every year I always make sure I get my annual physical, get my flu shot and everything like that. And that's one thing I do is I call my primary care doctor, who just happens to be Dr. Hazlett right now, and say, hey, we need to see you for a primary visit. And they'll get you in and get your lab work done at no cost. They do a screening just to get to know your doctor. It's important to establish care. Why was it important to establish care with somebody, you think?
Especially the first visit, because you want to get as much information, know as much about the patient, their histories. Everybody is unique and they all have a different background, and having that information and really spending time with that patient, especially that first visit, to know what's going on, it makes a big difference. Because if you can only spend 5 minutes, which if I was employed, that's kind of a way a lot of these big corporations are, you get this many minutes to spend with this patient, this many minutes to make your note and all of these different restrictions, you don't have time to really know them or get to know what's going on. I mean, the relationship with your doctor is very important.
Yeah. What do you, for patients that are coming from other locations, like say they moved from California, they're a refugee from California or something, how do they, they're worried about their medical history and stuff like that. How do you guys handle that kind of stuff when they come over?
Usually, well, we try to get as many copies of records that we can. Also, what
How
we
do they do
is
that? Like, is that like something you order them for the client? Do they have to order themselves? How do they get those medical records over?
It's a combination, because some doctors are great about sending over records, others can take quite some time. What we do, if you have anything done by us, any kind of testing lab, we always give you a copy of all your results so you have your own file at home, which I think is really important, because even if you're relying, oh yeah, I signed something, you can get it from my doctor. If you have something with you, it is very easy to, to bring. So everybody should have a packet of their last labs, and as much as they, have any imaging, anything that's really important, they should have a copy of on them. And I really strongly believe in that, and I give everybody their copies. So, but we will get them. We will get them from the hospitals. I mean, we try to get as many records as we can so that we know everything, because they can tell you the story, but we also want to see numbers, which is important, because when we're trying to look at labs, we want to know what it was before, because if everything's always been perfect, it's great, but that's not the case, and you kind of want to know what the pattern is so that we can better treat.
Yeah. So your life is always a little bit different as you go on everything like that.
Absolutely.
I want to talk a little bit just for a few minutes. There was a big scandal with you, and I want to just clear the air a little bit about that on the paper about you. I think it's good. This is a good forum for us to talk about that a little bit, and I want you to kind of explain that a little bit and what happened.
Well, some people may have read the article in the paper. In March, I was on a cruise. I came back in the night I actually returned. I had a very high fever, and I got like instantly ill. This was in the middle of when coronavirus, they hadn't really even started the quarantines or anything yet. This was very new to, with all of the restrictions, nothing had really started yet. I wanted to get tested, and I was basically told by the local hospital that if I needed to be life flown, or if I was, sick enough to be intubated, which that's kind of life or death type of thing where you're, respiratory failure, they could test me, but they didn't have enough testing at that time to do any testing. Now, I had very high fever. I was very sick. Luckily, I was able to get tested the next day, but I could, through a local lab, and I was negative. But I did have an article in the paper because it was very frustrating when I called around Vegas. I called everywhere and I couldn't get tested, and I thought that was so important because when you take care of all these people, and a lot of senior citizens who they said was a primary target, they have more health problems. You wouldn't want to get better and go into the office and be, and give anything or anything like this. So I quarantined myself until I had my negative result, which I was negative. And then they started the antibody testing about 3 weeks ago. My whole office, we all had our antibodies tested. None of us were positive. So we've never been, we're not immune, but we've also, never been around the virus. We've never contracted it or carried it.
So your office has been tested, been cleaned.
Oh, of course, yes.
You take almost care of your clients and patients, stuff like that.
Oh, definitely.
The biggest thing I like is just the fact that, working with you, with Humana, all those companies, it's great just to know that you're easy to work with. I think the biggest thing people love about you is the fact that the skincare lines are phenomenal. I know my wife even saw you for some question about some moles and stuff like that.
Right.
And also knowing the fact that you're able to look at more than just here's a pill, pop the pill and be good. It's something they love, the fact that we have the wellness center here and stuff, and really open people's eyes to there's alternatives out there. And a lot of people in Pahrump love that, and the fact that you're able to offer more than just the traditional, hey, take this, you'll be better. It's other things involved with that. Another thing, we need more board certified people out there too. And there's, I don't know people. What does it mean to be board certified really? I mean,
well, it means like for internal medicine, you basically have to sit for a second set of boards. You have to train and you have to meet an expectation in testing, and it's yearly amounts of extra work that you need to do to keep your certification, meaning that you're kind of on top of your game and that you know internal medicine and what you're doing. So
you're actually certified and you're legitimate, That's the biggest thing. Like, a lot of people are legitimate, but you have another board that keeps you standard.
Oh,
on the financial side of things, I have the financial planning board that keeps me in line too, that says, every year I have to do continuing education classes and say, pay them lots of money, and tell them, hey, this is what we're, I'm actually doing my job, and if I'm not held to my standard, I can lose that certification too. And those are always good things. What are the biggest things right now, outside of coronavirus, what are some of the biggest concerns people are having medically right now and that you've been seeing a lot of?
There's always diabetes and there's always chest pain. So there's people are always afraid, is it their heart, is it something else? And it's a very important thing to know what kind of symptoms really can mean your heart, what kind of symptoms are more like chest pain, like you've done an injury or you have costochondritis. And I always tell my patients when they tell me that they have chest pain, think about it this way. Were you active when you had the chest pain? Did you start to sweat? Are you short of breath? Did you rest and now it went away? If you tell me, you're just watching TV and you have chest pain, it's probably not your heart. But if you told me you got up, you brought groceries in, you got short of breath, you started having chest pain, you sat down, you felt better, now I'm worried about you. So you want to know, and you want to know when to get tested and what to do. And we do have a cardiologist here in town that does cardiac PET, which is a fabulous alternative to the old-fashioned stress test because it really tells you your risk of having blockages in your heart. It also tells you sudden cardiac death risk. So it's a very good test. So for someone, if you're worried about your heart, that's a very important thing.
That's awesome.
And we can set you up to see him as well.
I think I want to talk more about that. We're going to go to a break in a minute, and I want to talk more about that, talking about heart health and things like that. And we'll talk about it after this break. And I think we have a few more seconds. But I think it's Dr. Eric's office, right, is who you're talking about, referring to? He's actually part of the Humana network, too, and a part of the referral network. Not only is he here in town constantly, he's actually a part of our community as well. And
He
hopefully
lives,
we'll have
yeah,
him
he
on.
lives in my same community.
Yeah.
So.
I think the biggest thing people love in Prump is those that we all live here and we're a part of the community. You see us in the store, meet you everywhere we're at, and it's great to know that we have a physician that's here, that stays here in the community. She's built the business up here, and we'll come back to that.
We will return with more Doc Talk after these messages.